And it is now my pleasure to introduce Lynn Mathre. She's the president of Patients At a Time. She's also on the planning committee of this. She's a registered nurse. She's an addiction specialist. And along with Melanie Dreyer, I think she's probably the most known nurse in the world related to the subject of therapeutic cannabis. My wife, Lynn Mathre.
Good morning. You can leave that picture up. It fits. I think a lot of people, all they think of when they think of cannabis, I say the people, healthcare professionals who haven't been to conferences like this, they don't know what that picture is. They just know the leaf, and they think that's what medical marijuana is all about. I change my topic month to month as it comes to this conference, depending on who's going to speak and what they're going to talk about. And as some of the speakers were talking yesterday, I was noticing that we've got different audiences here. There are some people who know a lot about cannabis, and thankfully there are a lot who came here to learn a lot about cannabis. And I think that is the challenge we've got, is unlearning the lies. That's why it's been so difficult to try to make any moves anywhere. Even having the pictures up on the walls outside, up on the glass outside, was to an extent a threat to some. They thought it looked too much like there was a promotion of marijuana going on here. And I said, if someone would just read it, it's history. It's just information. We're trying to put out information. But that was something that was a challenge to people who've heard the lies too many times. So what I wanted to do is just give a little bit for those who don't know, who Patients Out of Time, who we represent, how we came about, and the handouts I left in here, which go back to the first day, they're a little out of order. I'll refer to them a little bit because it's just references that I think people can use quickly and easily to guide others to find some information. But a lot of this started with Bob Randall. He was mentioned yesterday and accordingly got the standing ovation. Bob Randall was the first modern-day legal medical marijuana patient using it for glaucoma. But Bob didn't just take the medicine and sit down quietly and enjoy it. He started the Alliance for Cannabis Therapeutics and worked diligently, he and his wife, Alice O'Leary, diligently, daily, for decades in making sure other people got that medicine. They made protocols for patients because, the FDA required a large amount of information to be submitted to get access to the investigational new drug program that would allow them the cannabis that was grown by the government in Mississippi. They had to work through the DEA. It was just a lot of work to get this medicine. And so they made the paperwork all handy. So for a glaucoma patient, the physician just needed to fill in the blanks about that patient. Or maybe for a multiple sclerosis patient, it was fill in the blanks. For AIDS, for the common things, they made this much more easy for them. I found out about Bob in the early 80s when I was working in Washington. And at Washington, at a small island hospital, but a patient from the University of Washington who was undergoing protocols for the now Marinol came to the hospital, and our director of nursing just about went crazy. I was the charge nurse on the unit, and she came up and said, "Mary Lynn, someone's got marijuana. What are we going to do? He's supposed to come to the hospital." I said, "Well, that's okay. If you feel better, we'll lock it up with the narcotics." But it was an elderly man that came in, and he came in and he had his two grown children who were there to tell me about how this Marinol, they thought, saved their father's life. He was wasting away. And that hit me. But about that time, again, serendipity comes along. Somehow, at Whidbey Island Hospital in Puget Sound, Washington, I got this flyer about the Alliance for Cannabis Therapeutics from Bob Randall, telling us about his access to cannabis and the fight to help other patients get it. And that was just kind of something that's stewed with me for a while. After Whidbey Island, Al was transferred to Ohio, and I went to graduate school at Case Western, and I ended up doing my thesis on marijuana disclosure to healthcare professionals. At that time, I just wanted to know, are we asking people about it? It's the most used illicit drug. Do healthcare professionals care? We should care about what they're using so that we can find out if it's hurting them or helping them and give them good advice. So how do you find that out? How do you ask people about marijuana? Well, I'll go to Normal, the National Organization for the Reform of Marijuana Laws. I figured most of their members use marijuana, so hopefully we can get some help there. They agreed to send out my survey, so we sent it out, and I ended up, I think for the thesis, it was maybe 700 responses. In total, I got about 800 responses of people using marijuana from age 18 to, it was into 80 or so. Most were never asked by their healthcare professional if they used cannabis. But if they were asked, more than 50% did say that they would admit to use because it's a healthcare professional and they should know, which is what I was happy to hear, and that's what I thought. One of the disappointments about that study was I said, would you be more willing to tell a physician or a nurse? And they were more willing to tell a physician. And my disappointment was because it was of the confidentiality. They were well aware of the confidentiality between a physician and a nurse, a physician and a patient, but some of them said, nurses talk too much. Or I can't tell the difference between my nurse and some of them were thinking doctor's office, the receptionist. And for my thought, I was just thinking the longer relationship with a nurse, but I was looking from a hospital point of view, and some of these patients were talking from their long-term physician, so it's good to know that they would talk to a physician. But in the end, I asked, there were a lot of things that came out of the survey, but the last question was, what are your health concerns about cannabis? Is it, and I gave them a checkoff list. I worry about my heart. I worry about my lungs. I worry about what it'll do to my brain. If I'm pregnant, I worry about the fetus and other. And I actually I don't have any concerns even though I'm a moderate user. I don't have any concerns even though I'm a heavy user. And then I asked other. That other was filled in a lot. I use it for migraines. I'm a spinal cord injured patient. I use it for spasticity. I've got glaucoma. And there it was in front of me. There's something going on besides, and there was this Bob Randall, and now is this. And so we started going from there. I got a little bit more active with NORML. By 1990, at the NORML conference, we got the first 5 legal patients, and that was Elvie Masica, Irv Rosenfeld, George McMahon, who couldn't make it here, Corinne Millette, and it wasn't Barbara. Help me out, guys. And Bob Randall, number one. Number one man. Barbara Douglas came later. She's a patient with multiple sclerosis. Many of them came thanks to this. That was picked up by C-SPAN. We were very lucky. So across the United States, people saw these 5 patients talking about cannabis. And the phone went off. It just was ringing off the hook at NORML, people wanting to know what was going on. Bob got many, many calls. The protocol started coming in. And by 92, they shut down the only access that patients had to cannabis. There were too many applications coming in. Most of them were AIDS patients. And actually, when they closed the program, one of them said that there was a concern that there might be rampant sex among the gay population if they got this cannabis. But they shut the program down. When they shut that program down, there were 15 patients getting their cannabis. There were 30-some who were approved to get their medicine, but the government said, sorry, you're never going to get a supply from us. And of the other hundreds of applications waiting, we're not going to look at them. They closed that program. By 1995, there were 8 patients left. And that's when we came about in terms of patients out of time. It was with some of the legal patients, other healthcare professionals, and just saying, this, probably the biggest lie we've got out here, or the biggest excuse healthcare professionals use, everyone uses, is we need more research. And that's what Patients Out of Time is all about. We don't need more research. Patients would love more research. There's a lot more research to be done, but there is no more need for research for patients to get it.